The life-saving drug you need to know. Physostigmine. How to never forget this life-saving med. Alright, let's talk about a med that can literally save lives. Physostigmine. If you ever need to reverse an anticholinergic overdose, this drug is your go-to antidote. And trust me, you don't want to be the nurse who forgets this one when your patient is spiraling into a toxic mess. Physostigmine, what is it? Okay, here's how I like to think about physostigmine. Imagine someone has taken way too much of an anticholinergic med, let's say atropine. Now they're hallucinating, can't pee, can't sweat, their heart is racing, and they're basically a confused, overheated disaster. That's where physostigmine comes in. It's like hitting the reset button on their nervous system. Memory trick. Physostigmine fixes the dry mess. Here's how to remember this drug easily. Physostigmine fills the body back up. Imagine your patient is dry as a desert from an anticholinergic overdose. This drug brings them back to life. Physostigmine fills the body with acetylcholine. How does physostigmine work? The science made simple. Okay, time for a quick breakdown of how physostigmine actually works. No crazy jargon, just real talk. Physostigmine is a cholinesterase inhibitor, meaning it stops the breakdown of acetylcholine. More acetylcholine equals to your parasympathetic rest and digest system wakes up again. More acetylcholine equals to more normal function. So if someone is in anticholinergic toxicity, meaning they're hot, dry, and confused, physostigmine brings back the balance by letting acetylcholine do its job again. When do we use physostigmine? Indications. So when do we actually give physostigmine? Simple. If someone has had way too much of an anticholinergic drug, like atropine overdose, scopolamine toxicity used for motion sickness, benztropine overdose used for Parkinson's, too many antihistamines, like diphenhydramine. Basically, if a patient is acting hot, dry, blind, mad, and full of retention, physostigmine is your antidote. Side effects, what you need to watch for. Okay, just because physostigmine saves lives doesn't mean it comes without risks. Let's talk about the side effects. Common side effects: sweating, nausea and vomiting, salivation, a little drooly moment, abdominal cramps. But if a patient starts showing signs of too much acetylcholine, watch out for these adverse effects. Adverse effects: call a doctor. Bradycardia, heart rate slows down too much. Severe bronchospasms, they can't breathe. Seizures and muscle twitching, neuro overload. Basically, too much of a good thing is bad, so we have to give just the right amount of physostigmine. Who should not take physostigmine? Contraindications. Okay, now listen up. Some patients should never get physostigmine. It can actually make their condition worse. Asthma can trigger bronchospasms. Heart block can make bradycardia worse. Parkinson's disease. Too much acetylcholine makes symptoms worse. Food and herbal interactions. What to avoid. Now let's talk about food and herbal interactions because yes, this matters. Avoid these while taking physostigmine. Nicotine, it messes with acetylcholine levels. Alcohol increases confusion and dizziness. St. John's wort messes with drug metabolism. Nursing considerations, what you need to watch for. All right, nurses, here's what you need to keep an eye on when giving physostigmine. Monitor HR and BP, risk of bradycardia. Watch for respiratory distress, can trigger bronchospasms. Give slow IV push too fast, which can cause seizures. Have atropine ready in case you need to reverse physostigmine. Boom, you just learned everything you need to know about physostigmine in under 10 minutes. Now you know how to never forget it, when to use it, and what to watch out for. If this helped, don't forget to like and subscribe for more easy med breakdowns. See you next time.